Stay away from ginger if you have these following health problems. Ginger is a medicinal plant that has been used since the dawn of time in traditional medicine to treat health problems. This spice, highly prized in many kitchens worldwide, helps lower blood sugar and cholesterol levels, alleviates pain, improves digestion, relieves nausea and bloating, and helps prevent cancer. However, although this food represents a mine of benefits, it can have undesirable effects. Who shouldn't consume ginger? In today's video, we will share with you the side effects of ginger and the health situation you should avoid when consuming ginger. Number 1. Bleeding problems. Among the essential virtues of ginger, there is its anticoagulant power. This spice indeed helps inhibit blood clotting, an unwanted effect in people with blood disorders. This problem is caused by slowing down coagulation, leading to slight or more severe bleeding in later stages. Consuming ginger can make it worse for these people and lead to excessive bleeding. Furthermore, ginger is known to have similar effects as aspirin. It can slow down blood clotting and can cause thinning of blood to take place. This side effect of ginger can be dangerous for patients who are already on medication that prevents blood from clotting. Also, it should be noted that consuming ginger with a clove of garlic can result in unrestricted bleeding. Do you find this video interesting so far? Please don't forget to subscribe to my channel, hit the like button, and ring the notification bell if you want to see more content like this. Number 2. Gastrointestinal problems. Ginger reduces nausea and drives the metabolism to full speed, but, or perhaps because of its gastrointestinal complaints, such as heartburn, bloating, nausea, flatulence, and worse, can be exacerbated or triggered by ginger. The reason is the increased secretion of gastric acid, and not everyone can tolerate the spiciness. If you have a sensitive stomach, you should control your ginger consumption significantly and consistently refrain from highly concentrated variants, such as ginger shots or smoothies. People who are extremely sensitive to this should only enjoy ginger tea in moderation. Moreover, ginger is known to stimulate the secretion of bile. This consists mainly of bile salts, water, and cholesterol, among others. Since gallstones are mainly caused by bile high in cholesterol or lacking bile salts, an increase in bile production would not be of many benefits. Thus, people who have gallstone problems should seek the advice of their doctor before consuming ginger. Number 3. Pregnancy. The consumption of ginger by pregnant women is very controversial. While it can effectively relieve nausea or vomiting that accompanies the first trimester of pregnancy, it is a danger since it can cause uterine contractions leading to premature delivery. Moreover, ginger can have a labor-inducing effect during pregnancy. That is why doctors advise pregnant women against using the healing route. In general, a low dosage should not be unhealthy, but every woman reacts differently to the tuber. To avoid inconvenience, pregnant women are therefore advised to avoid the consumption of ginger or ginger tea, especially during the last semester of pregnancy. Number 5. Surgery. Ginger is known to react with anesthetics used in surgery. This can cause an adverse reaction that results in bleeding and delayed healing. Most surgeons and anesthesiologists recommend removing ginger from the patient's diet 1 week before surgery. Furthermore, taking ginger is contraindicated before surgery, and this is because this spice has a solid anticoagulant power, which could cause excessive bleeding. The root, used as a medicinal plant for thousands of years, has a blood-thinning effect. Especially those who are about to have an operation should therefore avoid too much ginger. But even those who have their periods should avoid consuming too much ginger because that can lead to more severe menstrual cramps. Number 6. Certain medications. Ginger can interact with certain medications and cause serious side effects. This spice is particularly not recommended in the case of taking anticoagulants or beta blockers because it can multiply their effects tenfold. Ginger is also contraindicated in diabetic treatment, as explained below. Ginger is a natural remedy for diabetes, hypertension, and it acts as an anticoagulant, so its effects can amplify the effects of treatments for these diseases. People on medications should seek the advice of their doctor before consuming ginger. Number 7. Diabetes. If you eat ginger while taking diabetes medication, you are compromising the effectiveness of your treatment. Indeed, ginger will prevent the active agents present in medicinal products from working 100%. Moreover, people suffering from tension should also refrain from consuming ginger. This plant boosts blood circulation. Ditto for people taking anticoagulant drugs. According to different scientific studies, ginger can reduce blood sugar levels and improve insulin resistance. It is therefore very beneficial for people with diabetes. But when taking drugs to treat this condition, ginger may interfere with the treatment due to its hypoglycemic effect. It is therefore essential to consult your doctor before consuming ginger. Number 8. Low-weight people. Ginger is excellent for people looking to lose weight. Indeed, this spice activates thermogenesis, causing the body to draw on its fat reserves to restore its average temperature and reduce appetite. A study published in the journal Metabolism, Clinical and Experiment confirmed these effects of ginger, conducted on 10 men. Some of them were given a dose of 2 grams of ginger powder dissolved in a cup of hot drink for breakfast. The study results showed an increase in thermogenesis and a reduction in the feeling of hunger, which proves that ginger can be used for weight control. Given effects, ginger is therefore not recommended for underweight people or those who want to gain weight. Number 9. People who consume certain herbs. As with medicines, ginger can interfere with certain plants with anticoagulant effects and increase their effects. These include garlic, onion, ginseng, flax seeds, turmeric, or ginkgo. Combining ginger with these foods can pose a risk to your health. Additionally, ginger has been reported to cause severe allergic reactions, such as difficulty breathing, the closing of the throat, swelling of the lips, tongue, itching, or hives. In such cases, one should immediately stop consuming ginger and consult a physician. Number 10. Blood disorder. Some people have circulatory problems because of the abnormal consistency of the blood. There is hemophilia among these pathologies. The patient frequently suffers from internal and external hemorrhages because of the low capacity for blood clotting. But even those who have their periods should avoid consuming too much ginger because that can lead to more severe menstrual cramps. As a further side effect, ginger can inhibit blood clotting. If you take blood thinning medication, you should avoid large amounts of the tuber and discuss with your doctor whether you can use ginger. Even if you have persistent nosebleeds, too much ginger can make the bleeding worse. Ginger improves circulation and increases blood flow while preventing blood clots. It could increase the risk of bleeding, especially if you have a bleeding disorder or take medicines that slow blood clotting. Number 11. High blood pressure. Ginger, yes or no? Many patients with high blood pressure are likely to be faced with this question. There is no general recommendation, as the extent to which ginger can be harmful to high blood pressure has not yet been thoroughly researched. Doctors observe, however, that eating foods or tea containing ginger can briefly increase blood pressure. Suppose you would like to consume ginger anyway. In that case, it is advisable to talk to your doctor beforehand and evaluate the situation individually, depending on the severity of the high blood pressure. Ginger does not have to be equally harmful to everyone with high blood pressure. Number 12. Visual sensitivity. Ginger consumption is also known to cause visual sensitivity to bright light. This fact is still under scientific observation. People who tend to exhibit such symptoms are immediately advised to stop ingesting ginger in any form. Number 13. Irritation of the oral mucous membranes. While ginger is not as hot as pepper, you shouldn't underestimate the tuber. Ginger can't compete with pepper, but the heat is enough to cause side effects for you. It is common for people to report a burning sensation in their mouth after eating ginger. Mainly, the oral mucosa is then affected. According to studies, this irritation can lead to an unpleasant taste in the mouth, and in some cases, it can trigger related allergies, like tingling and swelling of the mouth. So pay attention to your body when consuming ginger. Once you feel a burning sensation in your mouth, you should not consume any more ginger. Excessive sweating is also a symptom of overeating ginger. Notice your body's signals. Now, you can safely eat ginger in moderation. However, if you belong to a risk group, you should also avoid highly concentrated ginger drinks, such as ginger shots, to be on the safe side. In addition to heartburn, gas, and diarrhea, high consumption of ginger can also irritate the oral cavity. Ginger also has blood thinning properties. This may cause you to have heavier periods than usual. If you are already using a blood-thinning medication, you should first consult your doctor before consuming ginger. Otherwise, the effect of the medication can be amplified. Although ginger is considered helpful for vomiting, pregnant women should also consult their doctor first. Did you find this video helpful or informative? Let us know in the comments section below. Make sure to subscribe so you don't miss out on my future videos. Don't forget to like and share. Stay healthy!